first question is from Richard Gonzalez, who said, "Hey, Dr. Islam, what can someone do about flare-ups when it comes to hemorrhoids?" All right, great question, Richard. So hemorrhoids suck. Yes, they do. They're a little pain in the bottom for a lot of different people, and they can cause symptoms like pain, bleeding, itching, or pressure, a lot of gut issues as well. It could be really discomforting to have that. Now, there are a couple different options that we can do to get those hemorrhoids taken care of, and there's three main options I want to talk about. Number one, which is what a lot of people do, is more medical options. So they're over-the-counter treatments for hemorrhoids, whether it's witch hazel, maybe it's hemorrhoid creams, maybe it's other things like that, like sitz baths, making sure that you soak your bottom, things like that. These are very effective temporary fixes when it comes to hemorrhoids. Now, also whenever you have hemorrhoid issues, you have to make sure that you're flowing and you're not having issues with constipation. So try to add some fiber, maybe add some Miralax as well. This is some of the more conservative options that you can do, and this can sometimes help out with some of the symptoms when it comes to hemorrhoids. There are prescriptions that we can prescribe for our patients, including sometimes if there is a fissure or a tear, we can give you a nitroglycerin ointment. Sometimes we can use some steroids as well in your bottom. But these, once again, are only a temporary measure. They don't fix the actual problem. And once you have issues with hemorrhoids, there's a very good chance that they can come back. But these are some things that we recommend for our patients to try and do at home if they cannot get those hemorrhoids fixed. So let's talk about the other options. There are two ways to mainly fix them. One is the one that we do called hemorrhoid banding. The other option is to get them surgically fixed. So getting your hemorrhoids surgically fixed by a surgeon sucks. It is terrible. It is painful. It is not fun. It is not anything that you want to go through at all. It is a very hard procedure, mainly because that area of your bottom has a lot of nerves, a lot of blood supply. It's very difficult to heal, which brings in the options that we do for our patients, which is hemorrhoid banding. This is a very effective, safe, and for a lot of our patients, it is a painless procedure. We place a small little rubber band around the hemorrhoid. It strangulates the hemorrhoid. You feel the urge to poop or maybe some pressure in your bottom for about 24 to 48 hours. And eventually those hemorrhoids go away. And once again, this is a fix for hemorrhoid issues if you ever have problems with hemorrhoids. But if you can't do that or you don't want to do that, we do have some of the more medical options. They work okay, but they're not the best options, but they certainly are better than nothing. Great question, Richard.